Okay, good afternoon, everybody. And today we're going to be discussing microbial disease of urinary and reproductive systems. At the start of this slide set, there are a number of slides of the anatomy of both male and female urogenital systems. I'm not going to go through these in detail, although I may have reference to them a little bit later on. So please make sure that you revise these, remembering what you did in A and P. The first thing I want to tell you is that up until recently, it was believed that large areas of the urogenitary system were in fact sterile. And then it turns out now that they are not as sterile as we once believed. So, for example, of course, it was clear to everyone that the vagina had a rich microbiota, and that has been known for a long time. But it was thought that, for example, the uterus was sterile. It turns out that that is not true, and that there is, in fact, a microbiota in the uterus that is distinct from that in the vagina. Not only that, if we look at the urinary systems, it was known that, for example, the lower reaches of the urethra, both male and female, might have resident populations. But that it was always thought that higher up, there were none. It now turns out that, in fact, there is a microbiota in the bladder, not a very rich one. It's not a very high number because of the passage of urine is so rapid that it keeps the populations down. But it is important because there has always been this idea that if you took a urine sample, a midstream urine sample, it would be sterile. It turns out that that is not true. And in fact, that urine picks up bacteria from the bladder and then from the urethra as well. So the fact that there are bacteria in urine is no longer taken as an indication that there is an infection somewhere. Instead, we use a standard now where if the bacterial number is above a certain level in the urine, we take that as indication that there is, in fact, an infection. So on that note, let's talk first about the microbiota of the vagina. And the most important and predominant group of bacteria in the vagina are the lactobacilli. And these are tremendously important for vaginal health because they produce both peroxide, H2O2, and they produce lactic acid. They lower the pH of the vagina. And by doing so, they exclude many potential pathogens. The lactobacilli also respond to changes in levels of estrogen. And that is probably because they are responding to changes in the structure of the mucosa and of mucus itself. There are other bacteria present in the vagina, streptococci, various anaerobes, gram-negatives, that may well be derived from fecal contamination, such as E. coli and Proteus. But these are kept in low numbers and do not normally cause a problem. In addition, for most women, this organism, Candida albicans, can be isolated. Candida albicans is a yeast. It is a single-celled fungus, a eukaryote, and it is normally in very, very low numbers. It does not like the low pH caused by the lactic acid. And when the pH of the vagina changes, it makes it, if the pH begins to rise, then it actually makes it possible for Candida albicans to begin to bloom, to replicate, and cause problems. And this is the characteristic yeast infection, which produces itching and a purulent discharge sometimes. And this is in response to changes in the structure of the microbiome of the vagina. So talking about the urogenital system, the first symptom very often of any infection is a urethritis. That is an inflammation of the urethra. And this can be extremely painful, and is often the very first symptom that a patient will notice about when an infection has begun to set in. Cystitis is inflammation of the bladder, of the urinary bladder, and it indicates that the infection which has spread throughout the urethra and then into the bladder as well. Ureteritis is potentially very serious. This is inflammation of the ureters leading from the kidney down to the bladder. And pyelonephritis is an inflammation of one or both kidneys. And this can cause intense pain, and the pain is called pyuria. It refers specifically to kidney pain. Now, the infections of the urinary tract are in fact incredibly common, and much more common in women than in men, but they do definitely occur in men as well. And the majority of these urinary tract infections are due to 3 organisms. I've only put 2 here, but they're either Proteus mirabilis, Escherichia coli, or chlamydia. And those are the commonest causes of these infections. So accepting that the first sign symptom is a urethritis is very important when that is reported, that some diagnosis is made, because urethritis is almost always an indication of infection. We divide them into 2 groups. The first, a gonococcal urethritis, and that is the urethritis caused by the causative agent of gonorrhea, Neisseria gonorrhea. The other group are the non-gonococcal, or you'll see it also referred to as non-specific urethritis. And that can be caused by a wide variety of organisms. Most commonly, it is caused by chlamydia. And chlamydia far outranks even gonorrhea as a cause of urethritis. But there are numerous other organisms which can also cause that. And some of them immediately you'll recognize: E. coli proteus, derived from fecal contamination. And that is very often because bacteria are being introduced into the urinary system from, I would just say, poor hygiene, but it's in actual fact it's very easy to contaminate from the perineum, from the anus, and then from the perineum. So it's not necessarily poor hygiene, it's just unfortunate hygiene tends to introduce these bacteria. There are numerous others that can do it, but these are by far the most common: chlamydia, E. coli, and proteus. So let's talk a little bit about cystitis, which is inflammation of the bladder. Again, cystitis is most commonly caused by E. coli or by proteus. And these result in inflammation of the bladder wall, and they produces polyuria, which is frequent urination, and dysuria, which is painful or difficult urination. And it may be accompanied by pyuria, by pain in kidneys as well. Now, this is very much more common in women than in men. And I'm just going to refer to this again. This is from the anatomy slides to show you why. First of all, notice the proximity of the anus to the opening of the urethra in women. It's very close. Not only that, look at the length of the urethra in women. It's very, very short when we compare it to male anatomy, where the meatus, the opening of the urethra, is very far from the anus. And second of all, the length of the urethra is long, very, very much longer than it is in females. And this is the reason these bladder infections tend to be far more common in women than they are in men. So this there is some indication that careful wiping after defecation and that good hygiene can limit these, but really that is not the whole answer, because the entire perineal area tends to be fairly rich in bacteria derived from the anus. So the diagnosis of cystitis, we're remembering now we have to distinguish cystitis from just, if we're looking at the urines, we have to distinguish what characterizes cystitis as opposed to a normal urine. And cystitis is diagnosed when there are greater than 1,000 colony-forming units in a single species. And in addition, that is, and most people will require, most clinicians will require that be coupled with a positive leukocyte esterase test, LE test. Leukocyte esterase is an enzyme which is produced by our white blood cells, predominantly macrophages and neutrophils, when there is an active infection. So a positive leukocyte esterase shows that it is actually an infection which the immune system is responding to. There are various antibiotics that can be used, but most commonly nowadays, when you treat with nitrofurantoin. And the reason for that, nitrofurantoin is a relatively new antibiotic compared to for instance, the penicillins and things like that. And the reason we are using this is because most species of bacterium that cause cystitis now are actually resistant to the older antibiotics. They've developed resistance as a result of frequency of use of these antibiotics. So the most serious infection of the urinary tract is pyelonephritis, and that is infection of the kidneys themselves. And these are usually, again, caused by E. coli or Proteus, having spread from infections of the lower urinary tract, and actually having caused ureteritis. Sorry, it slipped out of my mind for a minute. Having caused a ureteritis and then having introduced bacteria into the kidneys. This almost invariably results in bacteria actually circulating in the bloodstream. And that, of course, is a risk factor for sepsis and septic shock, but these are not common consequences of pyelonephritis, but they can occur. Pyelonephritis is extremely difficult to treat, and it can set up a chronic infection in the kidneys. And this can actually result in substantial damage to the kidneys and become a life-threatening situation. In addition, even a single episode of pyelonephritis does increase risks of subsequently suffering from kidney stone. So the diagnosis, again, we're looking at urines as a way of diagnosing what's going on. And testing urine, you should have, for pyelonephritis, you will see a very high, very, very high bacterial count, greater than 100,000 colony-forming units. So that's 10 times what we saw in cystitis. 100,000 colony-forming units per milliliter of a single species, and again, a positive leukocyte esterase test. And these have to be treated very, very vigorously with strong antibiotics like cephalosporin. So this was just for my reference to you. Okay, so let's have a look now at diseases which are transmitted to the reproductive system. And the first that we're going to talk about are the sexually transmitted infections. used to be called sexually transmitted diseases, now more properly referred to as STIs, although I'm old-fashioned and I'll slip up and I will refer to them sometimes as STDs. The distinction being that a sexually transmitted disease implies that we see obvious signs and symptoms. And in actual fact, in many sexually transmitted infections, you don't see obvious signs and symptoms. The disease remains hidden even though it is active. So this is an unfortunate thing about these sexually transmitted diseases, because it means that people who are infected and are still sexually active are able to transmit very easily without any knowledge that they are doing so. And there are many, many, many different diseases of the reproductive system which are transmitted sexually, but we will only discuss a few of the more important ones. These infections are extremely common, especially in young sexually active people. And that, of course, is because young people tend to have a lot more sex and also tend to have more sexual partners than older age groups. The really important thing, and something I'm going to refer to again and again in our discussion, is that most of the diseases that we're going to be talking about can be prevented by the use of condoms. And the condom usage has been shown to result in population-wide decreases in the incidence of sexually transmitted infections. And I'll point this out to you when we look at some of the epidemiological data. So let's talk first about this disease, gonorrhea. Gonorrhea is, again, it's a very common disease. It's it is caused by the agent Neisseria gonorrhea. And please note, you are going to be asked about this name, so get it straight in your heads. Neisseria gonorrhea is a gram-negative diplococcus, and I've told you this several times. It's very rare to have a coccus that is gram-negative, but this is one of them, and it's usually a diplococcus. It occurs in pairs like this, and that is characteristic for Neisseria. It is facultatively anaerobic. It actually prefers a high carbon dioxide concentration, so it is a capnophile. And there are some important things to note about the incidence of gonorrhea. And I'll just show you here and then flip back to that slide. This graph here, it only goes to 2016, but I'll point out to you when we get there that there has been a continuation of this. So first of all, notice here, there is a very high incidence of gonorrhea. And that is, we start in 1941, and this is the United States. So there is a peak here in 1946, 1947, somewhere around there, and then it begins a decrease. So let me ask you, first of all, what do you think that peak is due to? Because there is something very important about that date. Okay, 1945 was the end of the Second World War. And this represents the return to the United States of many, many young men who were infected with gonorrhea while they were overseas. And they return to the United States and then transmit the disease widely when they arrive. And this is the cause of massive public awareness campaigns, advertising the use of condoms, this sort of thing. But also, this is also the time when use of antibiotics becomes much more common. And there is a decrease in the incidence of gonorrhea as a result of that, of the two things, public awareness and antibiotic use. However, Have a look here, and what do we see here? Absolutely exponential increase in the incidence of gonorrhea. And what is this period here, 1961, 1971, the early 70s, what is this? This is the age of free love. This is the time this great social revolution took place. Almost say a sexual revolution, as sexual liberation became part of the zeitgeist. And as a result, there was a massive increase in sexually transmitted infections. Coupled with this, I have to say, this is exacerbated by the fact that the Neisseria strains were beginning to show resistance to the current antibiotics. So then have a look here. Now there's a massive decrease in the incidence of gonorrhea. Why? What is happening here in this period here? This is 1981, 90 into the early 90s. What accounts for this massive decrease here? And the answer is that this was the midst of the AIDS epidemic. And in this time, the use of condoms became extremely widespread. They were made very, very widely available, along with information about how to use them. Now, the intention was to reduce the incidence of HIV, human immunodeficiency virus infection. But along with that came a decrease in the incidence of all other sexually transmitted diseases. Not only gonorrhea, but syphilis as well. There was a massive decrease. Now, have a look from here on, and I have to tell you that this graph now is doing this. We are seeing an increase again. It more or less comes up like this to our current 2023. And we have to ask, what is this about? Why? Why is there this increase? And the answer to that is all of the emphasis on safe sex, on the use of condoms and safer sex practices has largely fallen out of the public discourse. And so people do not know, they do not realize that things like using a condom will actually prevent things like gonorrhea, infections with gonorrhea. And as a result, because people are simply not following safer sex practices anymore, we're beginning to see an increase again, and a very rapid increase in the incidence of these sexually transmitted infections, gonorrhea being only one of them. Okay, so these sexually transmitted infections are always wrapped up in cultural issues for fairly obvious reasons. But we always need to keep the two things in mind as we talk about it. So gonorrhea, sorry, I'll come back to this. What it does is it actually infects columnar epithelial tissues, and it creeps down in between the cells, and it results in a inflammation and a very vigorous response from the neutrophils of the immune system, which form pus. So pus is actually a characteristic of the formation of an infection by gonorrhea. So in the vagina, it does not infect the vaginal wall. It infects only the cervix, because the vaginal wall does not have the stratified columnar epithelium. Instead, it has squamous epithelium, and the cells can't infect those. They have to have columnar epithelium. So, but the columnar epithelium occurs widely, for example, in the urethra, in the throat, in the anus, all over the place. And all of these sites can be infected by Neisseria as well. So in the primary sign or symptom for men is the development of a very vigorous urethritis, extremely painful urethritis. And men tend to report very, very quickly to a medical professional. Neisseria is extremely infectious. So in men, the infection rate, about a third of men would be infected from a single exposure. About a third would be. And they will develop symptoms within days, at most within a week, 10 days, they'll begin to develop a urethritis. If they should ignore it and not have it treated, it can spread throughout the reproductive tract, and they can end up with epididymitis as well. But men tend to report very quickly because of the pain of urination. In women, because only the cervix is infected, they may not know at all that they are infected. There may be itching and discharge, but very often women will be completely unaware of the fact that they have been infected. This is very dangerous on two counts. First, they are infectious. And as a result, they can actually, if they are sexually active with more than one partner, they can definitely spread the disease. The second reason it's so dangerous is because the Neisseria can actually spread then up the reproductive tract. And it can be responsible for a number of different disorders throughout the reproductive tract. The most important being infection of the fallopian tubes. And that causes pain, and it also causes scarring of the fallopian tubes and predisposes women to infertility and to ectopic pregnancy. That is, having fertilized eggs implant in the fallopian tube at kind of blocked, their passage is blocked by the scar tissue. So they implant in the fallopian tube rather than implanting in the uterus. So the Neisseria is one of the commonest causes of pelvic inflammatory disease. And pelvic inflammatory disease is debilitating, reduces fertility, and it's extremely common, especially in developing countries, because it's a cause of considerable misery. That in both men and women, Neisseria can disseminate and cause heart problems, meningitis, arthritis, all sorts of things. One of the most terrible results of a woman being infected and not knowing is that she can transmit the Neisseria to an infant as it's born via vaginal birth, because the Neisseria end up entering the eyes and can result in blindness, which is called ophthalmia neonatorum. So women, if they are seeing obstetrician gynecologists to manage pregnancy, will be tested for a wide variety of sexually transmitted infections, just to ensure that she does not have. And if they do, then have to have them adequately treated, or adequate strategies put in place to prevent the infant from acquiring the sexually transmitted infection. Okay, so the other characteristic of gonorrhea is that it results in production of pus. And here, this is typical for production of pus from the urethra of a man. This has a special name. It's called GLEAT, G-L-E-E-T. And it, along with the urethritis, it's almost 100% indicative of a Neisseria infection. Now, the other disease, which is really common, in fact, commoner than Neisseria, is chlamydia. And chlamydia, we have talked about it in several different contexts in this class. It is the causative agent of chlamydial infection is Chlamydia trachomatis. And this is a very strange little organism, and it's extremely small. And you'll remember I told you that one of the things which indicates to us that the virus may have evolved from something similar. It is very, very small. It has very few genes. What genes it does have are particularly nasty. So it's an obligately intracellular gram-negative bacterium, cannot function outside of a host cell. And it infects via an even smaller unit called the elementary body. Go back, because I discussed the life cycle of chlamydia earlier we talked about it. Chlamydia is the commonest cause of urethritis, which is not gonococcal. So it is the commonest cause of non-specific urethritis or non-gonococcal urethritis. Very, very infectious, very, very easily transmitted, and probably our commonest sexually transmitted disease, I would say, apart from papillomavirus. Is often completely asymptomatic, especially in men, but they still remain infectious, which is one of the things that accounts for its high incidence. It also has an unfortunate effect that it causes subliminal damage, but that damage may predispose somebody to other infections, to infections with other organisms. And it often co-occurs with other infections. In men, it may be tolerated for a very long time before anything serious happens or before it fades away. But in women, there's much more likelihood of deleterious sequelae from the infection. The first is salpingitis. That is inflammation of the fallopian tubes. Chlamydia is also a major contributor to pelvic inflammatory disease. And the salpingitis is specifically inflammation of the fallopian tubes. There is also an increased risk of cervical cancer due to chlamydial infection. And it also poses a major risk to infants because they can become infected through vaginal birth. And as a result, chlamydial screening is usually performed on somebody who is pregnant before they give birth. The way in which we find it is by having a look at urines and doing a nucleic acid examination, looking for the actual genes of chlamydia present in it. Now, one of the risks to infants is to the eye, again to the eyes, because chlamydia has a propensity for infecting the tissues of the lining of the eyes and of the eyelids. And the chlamydia, by the way, can also be transmitted by hands and by vectors like flies. And look back, because one point I told you about the disease of trachomatis. Trachomatis is an infection of the eyes, which is one of the commonest causes of blindness in the developing world. This is also due to chlamydia. And it can also cause another very serious condition called lymphogranuloma venereum. And this is due to an infection of the lymphatics, particularly of the groin. And it is most common in developing countries. Usually the chlamydial infection will be picked up one way or another before it proceeds to that. And lymphogranuloma venereum is also a cause of elephantiasis. It blocks off the lymphatic system and causes this massive swelling of the limbs as lymph fluid accumulates. Chlamydia can be treated, needs quite fierce antibiotics to treat, but it is treatable. So just another word about pelvic inflammatory disease, just to emphasize its importance. It's due to the bacterial infections of the reproductive tract of females, and is particularly associated with infections of the uterus and of the fallopian tubes. And it's a very often mixed bacterial infection, but there are these Neisseria and chlamydia are the two which are most commonly the predisposing bacteria. And salpingitis is one possible effect of these pelvic infections, and again result in widespread infertility in populations where these bacteria are common. Okay, so let's move on, talk about this organism, Treponema pallidum. Treponema pallidum is the causative agent of syphilis, the disease of syphilis. And Treponema is a gram-negative, but it isn't a spirochete. Go back to the very beginning and looked when we talked about bacterial form. Looks like a corkscrew, a very tight, very thin, long cell, and the corkscrew is wrapped around a flagellum which runs through the center. And this causes the whole organism to spin on its axis. It is also the only bacteria which can go forward and backwards. It has this special locomotion because of its structure around this central flagellum. They're very, very thin, quite difficult to see, especially with a light microscope. They're just too thin. And as a result, we usually examine for them using a dark field. And that is the special lighting situation where the whole microscope field is in the dark. Light is shone from the side and reflected off the bacteria, and they appear as a bright white cell against the dark black background. So syphilis is an organism which requires some degree of damage to the tissues in order to be able to infect. But those can be microscopically small damages, like micro tears in the mucosa, anything like that, such as would occur during sex. That is how the organism gains access to the tissues underneath. It induces a very strong reaction from the immune system, but the immune system finds it very, very difficult to eliminate the organism. And some of the disease symptoms that we see associated with syphilis are due to the immune response, not so much due to virulence factors of the organism. So there are a couple of other strains apart from the one that causes the sexually transmitted infection. There are a couple of others that cause other diseases. And one that you'd see in developing countries most commonly is a disease called yaws, which causes terrible, terrible skin lesions. So this is what the organism looks like. You can see it's a tight spiral, and running through the middle of it, there is the single flagellum, which when it spins, causes the whole organism to spin like a corkscrew. So again, we see some interesting features about its epidemiology. And again, it's a story really similar to that of gonorrhea. The two often track one another epidemiologically. So here we see after the Second World War, an increase in the incidence. Then with the onset of public awareness campaigns and of antibiotics, a massive decrease, and then increase through to the 1980s. And then following the safer sex practice public awareness campaigns, a massive decrease in the incidence. But now, unfortunately, again, as for gonorrhea, we're seeing an increase again. And that increase is predominantly in young people, 15 to 25. So then that is exactly what you expect in your most sexually active population. Now, syphilis is potentially a very, very serious illness. It begins with the development of a sore around the spot where the infection took place. So the organisms entered the skin here, and it ends up reproducing in that area, but also causing an immune response, which results in this ulcer. But this ulcer is completely painless. Now, in men, it's often very obvious. They can see it. But in women, this ulcer may be high in the vagina or often on the cervix, and it is absolutely painless. So in women, the most that they often feel is some itching or some discharge, but not anything which would cause them to maybe report to a doctor. So that in women, it can be hidden away, and that is extremely dangerous, of course, because the woman then is infectious. This ulcer here produces an exudate. It's a serum that is leaked from the ulcer, which is incredibly rich in the spirochete. So this is very, very, very infectious. And for somebody to have sex at this stage, they are going to be transmitting a huge number of the organism. Now, this sore, here's what is so insidious about syphilis. This sore disappears. It heals completely after about a week, 10 days. But the organism does not go away. The organism now moves into circulation in both the blood circulatory and the lymphatics. And the next stage arises weeks to months later, and it is called secondary syphilis, and it produces skin rashes and rashes on the mucosa. And the mucosal rashes can break through as a lesion, which are highly infectious. Here you can see lesions on the hands. This is, again, due to a very strong immune response to the presence of the organisms. Now comes the most dangerous stage of all, because this, in fact, can resolve without any treatment and disappear entirely. But the organism is still present, and the organism now goes into a latent period. And that latent period can last for years, for a very, very long time, if not decades. And then the move to a tertiary stage. And this is due to reactivation of the immune system against the organism, and it causes massive damage. And at this stage, the person can begin to suffer from a very, very wide variety of manifestations. These here are called gummy, and they are ulcerated sores on here, visible on the skin, but they can be on any organ and drastically affect the functioning of that organ. So this is called gummatous syphilis, and this is due to gummas or gummy on the organs, often the skin. And these can also produce hideous deformations of bone and of the skin. So this, in the old days before treatment was available, these were very obvious signs and were absolutely dreaded. But syphilis can also cause cardiovascular damage. In particular, it weakens the aorta, and was in the old days was a common cause of aortic aneurysm, of a ballooning of the aorta, which was very liable to burst and hemorrhage. But the most dreaded symptom of all in tertiary syphilis was neurosyphilis. It begins to affect the brain. It affects the motor neurons. It begins to affect locomotion, and then proceeds to a dementia. And this stage here is very, very, very difficult to treat, because it's not so much the organism itself, it's the culmination of years of immune response to the presence. So I should tell you that this latent period here can mark the end of the infection. Only about a third of people actually proceed to the tertiary stage. There is another really serious effect of infection, and that is that the organism itself can cross the placenta and can cause congenital syphilis in a fetus. And the commonest manifestation of that is severe neurological damage. Now, the syphilis is easily treated. Even now that there are many resistant strains, it is still very easily treated. And it usually responds to a very short treatment with antibiotics. And the success rate is enormously high. So here's what I meant by having a look at the dark field. This is exactly what it looks like under dark field. You see these bright white cells against a dark background. But also you can also use a fluorescent antibody test. So this I haven't talked to you that much about. Fluorescent antibody tests. You have a serum with antibody, which is specific for the organism, coupled to a dye. And that dye fluoresces under ultraviolet light. So if you stain a sample with this, the antibody sticks to the organism together with its dye, and the dye glows when you shine ultraviolet light. And it gives you, this is two advantages. First of all, it's very easily visualized. But second of all, it's highly specific. This antibody is specific to the treponema. It's not going to stick to other bacteria. So you only light up the treponema in your preparation. In addition, there's a whole slew of other serological tests to test for syphilis. So syphilis, the primary sore of syphilis is often confused with this. These are ulcers which also can appear on the genitalia and can be mistaken for a syphilitic chancre. That is the name for the ulcer, chancre. But this is called soft chancre, and it's caused by an entirely different organism, Haemophilus ducreyi. Like it's a gram-negative rod. It's not a spirochete at all. The one really obvious difference between the two, they look similar to one another. The chancroid, soft chancre of Haemophilus, and the chancre of treponema look very similar, but the chancroid of Haemophilus is extremely painful. And it's accompanied by swollen lymph nodes. And this is completely different to the manifestation of treponema. It can break through, it infects the lymphatics as well. So it can break through into a horrible sort of ulcerative appearance at the lymph node. Again, it is treatable. One of the reasons why it is so important is that it often appears in conjunction with HIV infection and may be important in transmission of HIV from person to person. So I mentioned earlier on that this organism, Candida albicans, a yeast, a single-celled fungus, was a normal part of the microflora of the vagina, which it is, but it occurs in very low numbers. And it is also it's not only found in the vagina, it's found in the mouth, in the intestinal tract, all over the place. And it can overgrow in any of those sites. So, for example, oral candidiasis is called thrush, and that appears as white plaques inside the mouth and on the mucosa of the mouth. It can appear in the vagina, but also on the vulva, and it can spread both, in which case it's called vulvovaginal candidiasis. And it results from many different causes, and it's purely opportunistic. It's responding to change in conditions in its normal habitat. And the most common, actually, is antibiotic use, which wipes out all of the other elements of the microflora, of the microbiome in those areas, allowing Candida to then overgrow. And it can also be attributed to other causes. In women, it may very often be associated with hormonal changes during the menstrual cycle. And it is absolutely a characteristic of immune suppression in people such as people suffering from AIDS, or burn patients, or people under chemotherapy. It has a characteristic in women producing a yeasty, thick yellow discharge, but in oral thrush, it produces an intense itching and irritation of the mouth and of the mucosa. Again, it can be treated, and it's treated with antifungals such as clotrimazole, fluconazole, these sorts of things. And the last one to mention is not a bacterium at all. It's actually a protozoan, and this is Trichomonas vaginalis, which is a flagellate. It's a flagellated protozoan. Here it is here. And again, it can be found as a normal part of the microbiome, both of the vagina and the urethra. And it's is one of the organisms that responds to changes in the vaginal pH. And it also produces a discharge, but quite different to that of Candida. Instead of being a thick discharge, yellowish, pussy kind of discharge, it now produces a frothy, kind of greenish looking discharge, which is foul smelling, and accompanied usually by intense irritation. And the common name for it is trick. It occurs predominantly in women, but it can occur in men as well, and it can can produce a urethritis as well. And it is treated with an antibiotic called metronidazole, which is commonly used for flagellate infections of the gut as well. And that's it. And so I'll see you next week, and we'll continue our discussions then.